Chant, our Chief Health Officer, and also Dr. Catherine Pitman, who is from New South Wales Pathology and is one of our leading microbiologists. Well, we have good news today in the sense that we have 5 new cases. I'd still like to see 0. We'd all like to see 0, but 5 new cases is still particularly good. That takes us to 3,031 confirmed cases. We've had a total of 235,894 cases. 235,894 cases of people being tested, not confirmed, but tested cases here. And of those, 232,863 tested negative. So it's a fantastic result for us in New South Wales. We're certainly doing more testing in absolute terms than any other state or territory by a long shot. Of those 3,031 cases that we've had that were confirmed cases here in New South Wales, 2,300 have recovered. And that's also a very good indication to the community that we're doing very well here in New South Wales, extremely well. 315 have not yet recovered. And I'll ask Dr. Chant in a moment or two to just expand on the treatment regime for those people. Just remind people that obviously about 80% of people who get this virus have very mild symptoms, very mild. But it's still a reminder to the entire community that no matter how mild your symptoms are, runny nose, itchy throat, whatever it may be, you must not go to work. You must not. And you must actually go out and get tested. We've asked people to do that, and I have to say thank you to the community because the New South Wales community have responded fantastically. What we have seen is just in the last 24 hours, more than 8,000 people, 8,809 people have actually gone out and had the test. So thank you to all of our community for doing that. It's the second highest absolute number that we've had tested in New South Wales since this COVID-19 crisis started. The other highest was 8,835. So just a few more, but with one very, very big difference. That 8,835 people who went and got tested on the 27th produced 212 positive cases back on the 27th of March. This time, at a very similar figure, 8,809 tested have only produced 5 positive cases. So we have seen a 40 times better outcome for our community since the end of March. I must say, as a Health Minister, I'm absolutely delighted to think that we are doing so much better in terms of the rate of positives, and that it's an incredible outcome. In a few minutes, we'll also have some other details on the testing reagents through Dr. Catherine Pitman's comments. But I just want to address a couple of other issues while we have them at the moment. Obviously one of the issues for us is to try now and to strike the right balance. While we're doing so much better, we also know that if we take our foot off the accelerator, off the brake I should say, we'll certainly end up in deep trouble. We need to be careful in what we do. We've seen what happened overseas. We have been doing far better, but we need to be careful in what we do. So we're doing it in a gradual and careful way as to how we just lift some of these rather onerous restrictions we've had on our community in the last nearly 3 or 2.5 months. So I just want to make it clear, particularly with Mother's Day coming up, we've had requests about the reopening of a number of facilities that are usually specifically for women, but these days are sometimes more broadly used. Beauty salons, tanning salons, nail salons, waxing salons and so on. We are not opening those. As Health Minister, I can't open those. It's not the right time on the basis of the health advice we've had. But we are opening them for the purposes of limited activities, that is the retail items that people like to buy from these sorts of facilities. So I signed an order which has made it effective that from now, actually from yesterday, we will be able to go into, people will be able to go into those various beauty salons and so on, where they might usually get other services, but they will have the capacity to go in and buy their favourite retail products. Many people have a particular beauty salon, or so I'm told, a beauty salon or a tanning salon or a nail salon, a waxing salon, a tanning salon, none of which are really remarkably on my agenda, but still the opportunity to buy their favourite products is there. And how good is that with Mother's Day coming up? And you can also get vouchers, and I think it's fantastic from the point of view that it was raised with me by Leslie Williams, a member for Port Macquarie, who pointed out that a beauty salon in Port Macquarie was indicating that as you head towards Mother's Day and shortly thereafter, it's their best time of the year in retail. So, and generally other product or other services, but very happy to announce that they can now sell those products. So, and it's part of our steps anyway to make sure the message is out there that retailers can be open, but obviously we'd ask them to make sure that they ensure there's social distancing, the 1.5 metres, that people go into these retail outlets. I think the community gets that now, and also that the shops, the retail shops, will ensure that there's that separation inside the shop, but also the hand cleaner and so on, hand sanitizer. Just want to clarify a couple of other issues too. I was asked again yesterday by a couple of folks whether you could go for a motorbike ride. It seems there's a lot of people with motorbikes, which I didn't realise. I'm one of them. So quite happy to just make it clear that yes, you can. In fact, the Premier made that very clear, that going for a motorbike ride, provided you're not going off on a regional holiday, is just fine. Going for a drive is fine, but again, not for a regional holiday, not out into the regions wouldn't be such a great idea. In particular, I've had some people actually ask me for clarification. They have family members, for example, who have a disability, and it's one of the things that people love to do is to go out for a drive. So certainly if you're in that situation, if you have a family member who's, for example, aged or has got a disability, you can take them for a drive and make sure that they get out and enjoy life. Now, Dr. Catherine Pitman will have a few words to say in a few moments, but today I just want to make clear why she's here. From about a month ago or so, we had very, very limited supplies of a new rapid COVID-19 testing regime. New South Wales Pathology has managed to access far more of these kits. They're still limited. It's not an endless supply, but they have done very well to access these particular kits. And these particular kits allow testing to be done far quicker. They've been used in a number of regional areas just in the last approximately a month. Been used in Broken Hill, Tamworth, Coffs Harbour, Wagga Wagga. But what New South Wales Pathology is now trying to do is to roll those out, particularly to more regional areas. One of the challenges for us right from the word go in regional areas was to get the tests available, or get tests available, not these particular ones, but get tests available, and then get them transferred to the appropriate laboratory to run the tests. And of course the long distances that we have in this state have been challenging, and some of those tests have been taking 72 hours and in some cases even longer to get done. Obviously there's a transport issue, and that presents particular problems now that the airlines have largely stopped travelling across our fantastic state. So this particular testing kit, as she will show you and talk to you about, will mean that the tests can be done, particularly in those challenging regional areas, and still got to obviously swab the patient, still got to get that to the laboratory, and still got to use the appropriate equipment. But the actual testing itself will only take about an hour, but all up it could still take a few hours to get the result. But that's fantastic because it means that we can then do that tracing. We can get on to working out what that person's contacts have been, and that's going to help us even more. But I'll let her say more about that. I would just say one thing before I hand over to Dr. Chant before Dr. Pitman. Dr. Pitman is a scientist, a microbiologist. She is not a media person. She hasn't done any previous interviews, so just ask you to recognise that she's here as a professional person to give the best of her knowledge, but not necessarily understands about how to do press conferences. So just, yeah, be kind. Dr. Chant.
Firstly, can I echo the Minister's appreciation to the community of New South Wales? 8,809 people being tested is an extremely positive finding, and the challenge ahead of us is to sustain those high levels of testing. So I'm going to continue to urge the community, with even those minimal symptoms across the state, come out and get tested. And my message is particularly important for anyone who is working with vulnerable people. So aged care workers, disability workers, anyone who works in healthcare facilities. The minimal symptoms, please get tested. That's going to keep our community safe and allow us to identify any clusters of transmission very early and put in those effective public health measures. So there were 5 new cases from 8,809 people tested. There are currently 109 COVID cases being treated by New South Wales Health, and this includes 14 people being treated in our intensive care units, with 12 of those requiring ventilatory support. About 3/4 of the cases are in non-acute out-of-hospital care, and that reflects that the disease can be mild in many, but severe in particular groups, in particular the elderly and those with underlying health conditions. Of the 5 new cases, 2 locally acquired cases from a known source, 2 were locally acquired from an unknown source, and 1 is under investigation. There have been no new deaths in the 24-hour reporting period, and there were 2 new cases linked to the Newmarch House facility, and they occurred amongst staff, taking the total to 61 cases, including 24 staff and 37 residents. In those cases, we are looking at how those 2 staff members acquired the infection, and obviously looking at whether there were any infection control breaches, but also casting our net more broadly in terms of exposure to those staff. I'll hand over now to Professor